Oh, good. Here we go.
All right. Francis,
Hello.
really appreciate. Hi, how you doing? Thank you so much for taking a little bit of time out of your day. I know it's hot. I know it's busy. But I wanted to talk with you very briefly about your top surgery gender affirming operation that you had with us about 6 months ago. Tell me a little bit about what your thought process was heading into this with regard to sensation or perhaps pain that some people may talk about within the community about how things feel after this type of operation.
For me, I know the one drawback that I was afraid of was losing erotic sensation going into surgery.
Mhm.
When I asked my top surgeon, uh, Dr. Mosser, and he was like, "Well, I don't really do that, but then, oh, I'm kind of doing an experiment with this other doctor, and like, usually no, but maybe." And I was like, okay, cool. Like it just felt like really good timing.
Yeah, yeah. I was very fortunate because we had just started to work together. And it's not, he talks about it doing an experiment. I think it's really an experiment in terms of he and I working together, but we've done this hundreds of times, probably between 700 and 800 times with the cisgender female population. And it's been, very, very successful. And recall during your operation, we actually connected two nerves per side that we were able to identify and save, one to the underside of the nipple, the free nipple graft, and the other to the skin. And so, basically cutting to the chase, here we are 6 months after surgery. Tell me a little bit about, speak to what sensation is like in those areas.
The chest wall has been very present from the very beginning. Underneath the nipple, it was almost like there was like a bubble or something, but I could
Mhm.
like feel pressure.
Mhm.
And then at right around the 6 month mark, just one side and then the other, like I could, it's got like a achiness, but coming from a similar kind of sensation that we had just coming out, when it was
Mhm.
not like painful, when it gets to just the like, and not like I don't want to move painful.
Right. Yeah. And so as we were discussing before, I mean, would you rate your sensation in the nipple areola and then in the chest wall as good?
Yeah, the chest wall stuff is really good. The sensation, like like it's been like a week that with
Hmm.
the nipple sensation. So
Yeah.
it's just kind of like slowly getting used to that. And
Yeah.
it's really neat.
Yeah.
Just
Okay.
observing your body
Right,
through.
right. And so
Yeah.
yeah, and so it seems like it's continuing to improve, which is also something that you see, and that so it sounds like it's pretty good already, and it's likely continuing to get better and will continue to get better. And so I guess last question, tell me why that's meaningful to you. What has that meant for you at this point?
For me, the ability to like feel shirts, like when I put a seatbelt on for the first time,
Mhm.
like little things that I didn't even think about. Like I thought about the erotic sensation. I was just like, that'd be cool. Like I know that most dudes don't get to keep that.
Mhm.
Um, like that'd be cool, but as I am experiencing it, it's really cool to be able to feel stuff to I'm kind of a meathead. I like having the feedback when I'm doing my push-ups
Mhm.
and my ring rows and all that stuff. Like I can feel my arms move against my body,
Yeah.
and getting that feedback when I'm doing that or if I'm doing yoga or whatever. It's been I don't even know what I would do without that
Yeah.
tactile feedback. Like it's
Yeah.
really I get to feel it every day. It's really
Yeah.
great.
Well, that's great. And I think what you point out is really just so important. It's, erotic sensation for sure. That's a nice thing. We all enjoy that to some degree. But it's really that day-to-day kind of existence and all the little things that you don't realize you might not have until you perhaps don't have them, or you're recovering from surgery, don't have them for a while, and then they come back and you realize, wow, that's a big deal. So anyway, thanks so much for sharing your experience. We look forward to continuing to follow you. We've got about another 6 months where I think things are likely to continue to improve, and I think you're going to be even happier as time goes on. So I wish you the best of luck, and we'll speak again soon.
Awesome. Thank you.
Cheers.